Now, as you have already understood the view, we were discussing about the lingual. Now we discuss about that it is supplying the anterior two-third. We saw rest of the things. Inferior alveolar now. Now further inferior alveolar now, what does it do? Because it is the branch of the sensory correct sensory root, that is the posterior root. Now anterior root. Okay, one more thing is that can you see this, uh, can you see this auriculotemporal now? This is also a branch of the posterior division, correct? Now if you see this auriculotemporal now, if you see this auriculotemporal now, can you see this? It is giving a loop, and through which what is passing? Middle meningeal artery, which is, see, this is what, this is the maxillary artery. Yeah, sorry, this is the internal carotid artery. One second, I will erase this for you. See, this is the internal carotid artery. उसकी ब्रांच कौन, नहीं, external carotid artery, I'm sorry, external carotid artery. This is the external carotid artery. I'm showing it in blue, I'm sorry, I will show it in red. External carotid artery. उसकी ब्रांच कौन है? मैक्सिलरी आर्टरी. किधर है? ये रही. वो मैक्सिलरी आर्टरी इंपॉर्टेंट LAQ है, और क्लिनिकली HNF के सर्जरीज में उसका बहुत रोल है, जो तुमको हमको मालूम चाहिए. और वो मैक्सिलरी आर्टरी की कौन ब्रांच है? मिडिल मेनिंजियल आर्टरी. कैन यू सी दिस? दिस इज पासिंग थ्रू व्हाट? This is passing through what? This loop of what? Auriculotemporal nerve. And you can see this ditto scene, exact scene in your dissection. And that is just so beautiful. Very delicately you have to do it, but it's just awesome. Okay. And now, I just now, in the beginning of the talk, in the beginning of the discussion, I told you today, you have to remember this middle meningeal artery for me, right? Middle meningeal artery is going into the cranial cavity through which foramen? Foramen spinosum. Do you recall? I told you, foramen spinosum. So this is about the middle meningeal artery. Now you can see this, right? Now next, one more thing. Can you see this? Just one second. Where is that labeling? I don't know. This labeling is not shown here. This labeling is not shown here. No problem. But can you? Okay, it is here. Wait, I will have to zoom it. Okay. Okay. Now, can you see this branch? This small branch. Can you see this small branch? It is going inside like this. Can you see this? You know what is it called? It is called as nervous spinosis. Nervous. This is a Viva question which the examiner will ask you if you are answering very beautifully all the questions in the HNF Viva, in the dissection Viva, I mean soft parts, he will definitely ask you. This is branch is called as, see, I will erase it, you just see it. Nervous spinosis. This small branch, can you see this? The small branch, nervous spinosis. Why nervous spinosis? See, spinosis because it is going through what? See this here, one second. Can you see this hole? Behind these nerves there is one hole through which this artery is going. Which artery? Just now we discussed. Which artery? This is the middle meningeal artery. And this nerve, which nerve? Just now I told you, that is the, I will show it in yellow, wait. That is the this is the nervous spinosis. Nervous spinosis. Because it is going through spinosum, foramen spinosum, it is called as spinosis. And why nervous? Because it is going to go and supply the middle dura mater in the cranial fossa, middle cranial fossa, dura mater of the middle cranial fossa. So it is called as nervous spinosis. If Pidare sir will be there, he will ask you what is what is the nervous spinosis branch of the of this trigeminal, of this mandibular nerve. Okay, before it divides, before the mandibular nerve divides, this branch is already, it has come out. Okay, and this is foramen spinosum. This conceptual point we don't understand if we don't read thoroughly, and it's difficult to understand. Okay, So I was telling you this. So this branch is over. Then you are seeing these small branches. See, the name is written tensor tympani. One second. Tensor tympani muscle. Now to tensor tympani muscle. Okay, this branch. And the second branch is lesser petrosal nerve, right? Now lesser petrosal nerve I'll not discuss in detail. Tensor tympani. Now this tensor tympani muscle, actually, the wait, I will write here. See, now we will see about the mandibular nerve, right? We saw foramen spinosum mesenicula, anterior division, we saw posterior division. Anterior division, as I told you, it's the motor root, right? And it is supplying what? All the muscles of mastication. Now we saw that there are four muscles of mastication. They are the main four muscles. But there are accessory muscles also, which are called as muscles of mastication. Accessory. They, because they develop from first pharyngeal arch only. From first pharyngeal arch only. So there are 8 such muscles total. Okay, 8 such muscles. Now this can you see, this is the medial pterygoid muscle. Wait, I will show. See, labeling is also given. Medial pterygoid muscle. Okay. Now this medial pterygoid muscle and lateral pterygoid muscle, you already know. This part is the, this is lateral pterygoid. This is medial pterygoid. Now if you see that there is a branch which is directly supplying to this is the masseter muscle, right? Masseter muscle. इसके ऊपर से इधर temporalis muscle, that bone we are seeing from inside. We are seeing from inside. Remember this. I told you we are seeing from inside. There is another photograph or image which is showing from outside. In that I will tell you all that muscles. See, but just a rough idea. There are 8 muscles. 3 are elevators of the mandible. 3 are depressors of the mandible. And 2 are the tympani muscle. Tensor tympani muscle. Okay, tensors, you can say tensors, not tympani, tensors. One is tensor tympani. You can see this branch is here only. What it is doing? What it is? It will tense the tympanic membrane to balance the air. To balance the air. No, that is palati. I'm sorry, tensor palati muscle. Tensor palati muscle. That is going to modulate the opening and the closing of the eustachian tube. Tensor tympani muscle, and that is why it can close or open the eustachian tube opening in the pharyngeal part, and as a result of which the air balance in the middle ear and the throat is maintained by this eustachian tube. And this was my viva question. Okay, this was my viva question. She had asked me, the examiner asked me to show me where is the opening of the eustachian tube in the medial aspect. When you take a sagittal section from there, it is behind the tubal tonsil. Okay, by mistake I told palatine tonsil, then she said palatine tonsil is here, which is this one. Then I said, madam, it's tubal tonsil, and then she asked me the next question. So eustachian tube and tensor tympani muscle, this tensor tympani muscle is it is controlling the it is contracting the your tympanic membrane. So it once it contracts, it will dampen the sound. It will decrease the intensity of sound. So that is done by these two tensor muscles, tensor tympani and tensor palatini, and 3 depressor, 3 elevators. Now you have learned the muscles of mastication. You know the elevators, masseter and temporalis, right? Because fibers are coming from above to downwards. So insertion is on the mandible, so when they will be pulled, at that time it will elevate the mandible. So temporalis and masseter. But one more elevator muscle is there, that is the medial pterygoid muscle. Okay, medial pterygoid. Only one muscle is the depressor muscle, as you know, lateral pterygoid. So I had told you that they will ask you a question of except. all are the all are the elevators of mandible except, and they will write all the four names: masseter, temporalis, medial pterygoid, lateral pterygoid. So answer is lateral pterygoid because it is the depressor. Rest all are elevators. Now if you see this elevator, I already told you masseter and temporalis, and medial pterygoid is also there. But already we saw that medial pterygoid is getting branch from here. See, this is the branch for the medial pterygoid already. Understood? Medial. See here what it is written: tensor villi palatini muscle. This is not medial pterygoid. Medial pterygoid is not seen from inside. I am sorry, it will be seen from the outside aspect. Next diagram, this is the tensor villi palatini muscle, and it is going to take care of the opening of the eustachian tube. Okay, so these two tensors, and we saw the three elevators, three depressors. Now you know the only one depressor is lateral pterygoid out of the four muscles of important muscles of mastication. The accessory muscles of mastication is one is the mylohyoid muscle. Mylohyoid muscle is the oral diaphragm. Never forget it. So mylohyoid muscle and the anterior belly of digastric, that I will show from the other diagram. You will see it in that. Now here you are seeing this otic ganglion. Okay, this otic ganglion. Can you see this otic ganglion? I'm sorry. This otic ganglion. Can you see otic ganglion? Yes. This otic ganglion, what it is doing? This sensory fiber roots. This is the preganglionic. Okay, and fibers are relaying and postganglionic ऐसा जा रहा है in the posterior division, in the form of posterior division of the mandibular nerve. Now they, as I told you, one is the inferior alveolar nerve, inferior alveolar nerve, and this here it is the lingual nerve. Lingual we already discussed, tongue के उधर जा रहा है, sensations. But this inferior alveolar nerve, see, one more thing I was going to tell you. This lingual nerve, one, it is going and supplying the tongue. The second thing is that it is related to one ganglion, that is the submandibular ganglion. Okay, submandibular ganglion. Now, submandibular ganglion, just one second. I will, yeah, you will not be able to see all that in this diagram. I will show you the other diagram. Wait, please wait. Yes, this you, it is perfect. Uh, Now see this. Yes. Just one second. Huh? Yeah. See what we have done? We have removed the we have cut the zygomatic arch. Correct? We have cut the zygomatic arch. Then we are able to see this. What we are seeing, this is the temporalis muscle which is cut. Okay. Now temporalis muscle, as I told you, first let me tell you about those muscles. We talked about three elevators, three depressors, two tensors. Two tensors we saw from inside. Now three elevators and three depressors we are going to see. So you saw the masseter muscle, correct? See, masseter muscle in that diagram, and here you are seeing the temporalis. Now this is the posterior division, right? Anterior division अंदर के बाजू में, right? Anterior division is अंदर के बाजू में, and this is the anterior division, right? This is the anterior division. So here it is giving what? Buccal nerve, and not this. This is not the anterior division. This is the posterior division. Anterior division is inside, as I told correctly previous to my this statement. Anterior division is inside, that is why we could see the anterior division in the previous diagram from inside. This, what is the view? This is anterior, this is posterior. We are looking the right side of the person from outside. Now, so this we can see the posterior division. Now posterior division, if you see, there are two branches, right? Right? Yes, this is the lingual nerve, and this, see here, inferior alveolar nerve, which is cut. Okay, okay. Now I was telling you about the muscles. So which all muscles? As I already told you that the elevators are masseter, temporalis and medial pterygoid. I told you that medial pterygoid you will be able to see from this diagram. So can you see this here? Medial pterygoid cut muscle, they have cut it because this goes behind like this, right? And they ऊपर क्या है? Lateral pterygoid muscle. See, clearly understand. This is the medial pterygoid muscle. These are the lateral pterygoid muscles. ये superficial belly, ये inferior belly. Okay. So lateral pterygoid supply. It is the depressor. That is supplied. Branches are given here. Can you see this? Can you see this? Branch is coming and supplying these muscles. Okay. And they are also supplying this muscle. That is the medial pterygoid. Okay. And you are seeing this auriculotemporal nerve. This is the middle meningeal artery. This auriculotemporal nerve goes and supplies the superficial. Auriculo means around the ear, and temporal is the temporal region. So it goes and supplies the auriculotemporal part. Okay. Now one more thing is so we are finished with the muscles. We talked about the elevators. Now depressors. Now depressors, if you see lateral pterygoid, I told this is the lateral pterygoid. Now myeloid muscle. I need to zoom out 1 second. Myeloid muscle. Can you see this myeloid muscle? See myeloid muscle, it is cut here. Can you see this oral diaphragm? Can you see a diaphragm like structure? Myeloid muscle. In the dissection, you will see it very easily from this antero-inferior aspect. We had seen it. Myeloid muscle. So this myeloid muscle, oral diaphragm, it is also supplied by which branch? Which branch? Come on, this is the anterior division because all this motor supply is from what? Anterior division. Okay. And this auriculotemporal lingual branch and inferior alveolar branch, these are which branches? They are from the posterior division. Why? Because they are sensory. So I hope you have understood this. So anterior division is giving motor supply. So you have seen myeloid muscle, and another is the anterior belly of the digastric. तो ये डायगेस्ट्रिक का मसल इधर नीचे छोटा सा लेबलिंग दिखता है क्या? दिस इज द डायगेस्ट्रिक मसल, दिस इज द हाइयर्ड बोन. Here you are having the belly of this digastric muscle, which is formed by which deep layer of deep cervical fascia? Investing layer of deep cervical fascia. This way you should be able to connect things. So investing layer of deep cervical fascia. See, this is the posterior belly and this is the anterior belly, and here is the what is it? Ligamental part, na, which is forming the belt like structure from the investing layer of deep cervical fascia. Okay, so we saw the muscles. Now I was telling you about the otic ganglion. Now otic ganglion you saw from the inner aspect, right? The previous diagram. Now otic ganglion में से fibers कहाँ जा रहे हैं? Otic ganglion में से we have already discussed. Otic ganglion, come on, who will tell me? Okay, wait, I'll tell you. See, otic ganglion, it is present on the mandibular nerve, right? So this is topographic. अभी ganglion है तो उसके pre ganglionic fibers, post ganglionic fibers. तो this is present on mandibular nerve topographically, means anatomically. So it means that posterior ganglionic fibers are formed by mandibular nerve. So functional fibers or the functional nerve which form the preganglionic fibers, they are of which nerve? Glossopharyngeal nerve, which we already discussed in the last lecture, 2 lectures back when we discussed about the glossopharyngeal nerve. Understood? So functional nerve, it goes and supplies what? It supplies the parotid gland, right? Secretions of the parotid gland. So functional nerve is glossopharyngeal, and it relays its preganglionic fibers in this otic ganglion, and then from there postganglionic fibers go and supply to the parotid gland. Understood? Understood? So mandibular nerve is the topographical cranial nerve or the postganglionic nerve fiber. Now, one more thing is that this lingual nerve. Can you see this lingual nerve? This, wait, I will erase everything. Oh. Yes. Can you see this? This is the lingual nerve. Correct? Here it is labeled. This lingual nerve, here it is forming one ganglion, that is the submandibular ganglion. This submandibular ganglion, it further supplies the submandibular gland and the sublingual gland. जिभेच्या खाली sublingual gland, mandible आतल्या बाजूला submandibular gland. There is a fossa, when you learn about mandible. So this again, this is a ganglion, so it is going to have preganglionic and postganglionic fibers. Now preganglionic fibers are by the cranial nerve number 7, and postganglionic, of course, it is the lingual nerve, which is a branch of mandibular nerve, which is a branch of trigeminal nerve. So now it is giving fibers to the lower tooth also. Can you see these fibers? Can you see these fibers? See, This is the inferior alveolar branch. This is the lingual nerve. It is further giving the branches to the lower tooth, lower jaw. So lower jaw may it is giving. So pain sensations from the lower jaw are carried by this lingual nerve. Okay, and upper by maxillary nerve. We saw two diagrams behind. Understood? So buccinator muscle is also first arch muscle. So they are supplied by branches of this mandibular nerve. So we have discussed this all, and now finally I would like to conclude by drawing a small flow chart. Okay, just 1 second. Okay, so see this. The confusing part is about the ganglion. Now we saw four ganglia today. Otic ganglion. Sorry, first we will go in the sequence. Oh, see, first we saw the ciliary ganglion. So it is related to which nerve? That is the cranial nerve number 5 ka first branch, ophthalmic. Then we saw whom? We saw the pterygopalatine ganglion. Pterygopalatine ganglion. It is from, topographically it is related to cranial nerve number 5 ka second branch, that is maxillary. And third, we saw the otic ganglion, and after that, we saw the submandibular ganglion. These are related with third branch, that is the mandibular branch. Now, if you see preganglionic, postganglionic. Now, if you see, it is very simple. I am making for you, and there is nothing to get confused. When you will learn, now you already learned the cranial nerve number 9, so you know from where those fibers came in the otic ganglion. If you can recall, otherwise you can see that lecture. Okay, and now tomorrow when you will learn facial nerve, you will understand that from where those preganglionic fibers came into submandibular gland and the ciliary, not gland, submandibular ganglion and the ciliary ganglion. Now here for ciliary ganglion, 1 second. For ciliary ganglion, which fibers, preganglionic or the functional fibers, are from whom? They are cranial nerve number 7, and postganglionic of course from the nasociliary. Wait, I will write it in short. Nasociliary nerve. Pterygopalatine functional, it is from whom? Come on, it is again seventh cranial nerve, and this is for by whom? Yes, yeah, branch of pterygopalatine ganglion, right? Pterygopalatine. Otic ganglion, cranial nerve number 9, preganglionic fibers, and postganglionic, as you all know, it is from mandibular nerve, branches of the mandibular nerve. And this submandibular is again from cranial nerve number 7. तर म्हणजे फक्त आपला एकच रहस्य ऑलरेडी उघडलेलं आहे. बाकीचे जे 3 रहस्य आहेत ते फेशियल नर्वच्या डिस्कशन सोबत उद्या ते उघड होतील. अँड हिअर अगेन दिस द लिंग्वल नर्व विच इज अ branch of mandibular nerve. So this is very simple. This is about ganglia, and this is ganglia and pre and post. This is the most confusing part. And if you want a flowchart of the two important, see, ophthalmic nerve is very small. It is just having 3 branches. I already explained to you. Maxillary it is a bit. Maxillary and mandibular are a bit big. I will explain. See, this is the. I'll give you a flowchart. Simple flowchart. So this is the trigeminal ganglion. Trigeminal ganglion. It is giving 3 branches. So this second is the maxillary branch. Correct? Maxillary branch, before it comes out of foramen rotundum. See, this is foramen rotundum. Okay, it gives one branch, meningeal branch. Okay, meningeal branch. Then it comes outside the foramen rotundum. Immediately in the pterygopalatine fossa, it is forming one ganglion. Then this ganglion, you know what is the story of the ganglion. Then here it further continues as the it comes outside the inferior orbital fissure. We saw that just below the eye ऑर्बिटच्या खाली inferior orbital fissure आणि इथे येऊन inferior orbital nerve म्हणून तो continue करतो. Then it gives zygomatic nerve branches supplying the bone of the zygoma and all the parts of the maxillary bone. Then here you have your tongue. Then it gives the uh, superior alveolar nerve branches. This is posterior आणि इथे इथून काय देतो middle आणि anterior and they are supplying the upper jaw. This is your tongue, so they are supplying the upper jaw, correct? We saw all this. And along with that it also gives here branches to through infraorbital foramen it comes outside. Infraorbital डोळ्याच्या खालचं. Okay, infraorbital foramen. It is giving palpebral branch. Palpebra म्हणजे आपल्या डोळ्याची पापणी. Nasal branch and superior labial branch. Superior labial you heard when you discuss. Labia is labial. Superior labial branch is the lips, near the lips. Okay, so these are the branches. You need not go into the details. They are supplying all small branches, but this is how is the distribution of the maxillary nerve. That is a cranial nerve number 2 of the trigeminal. And if you talk about the mandibular, it is again simple. See, mandibular is coming outside from the foramen rotundum, correct? No, foramen rotundum, no? Yes, is it correct? It is not foramen rotundum, it is foramen ovale. Foramen ovale. Okay, and immediately it comes and it gives one branch. I told you which branch. Nervus spinosus, very important. And then it is giving one branch to the medial pterygoid muscle. This anterior division, correct? Anterior division is what? It is the motor division. But before dividing into the two divisions, the main trunk only gives one branch to medial pterygoid. So they will ask you a MCQ question. All of the following are derived from the posterior or anterior division of the mandibular nerve except nerve to medial pterygoid, nerve to lateral pterygoid, nerve to buccinator muscle and nerve to masseter or masseteric nerve. ऐसा करके देंगे तो यू हैव टू राइट मीडियल टेरोइड बिकॉज ये किधर से निकल रहा है, मेन ट्रंक में से निकल रहा है. ये नर्वस स्पाइनोसस भी कहाँ से निकल रहा है, मेन ट्रंक में से निकल रहा है. देन एंटीरियर डिवीजन, दिस इज द एंटीरियर डिवीजन, दिस इज द पोस्टीरियर डिवीजन. Anterior division is going to go and supply to all the muscles of mastication. We saw 8, 4 are main and 4 are accessory, from which total out of these 8, 3 are elevators, 3 are depressors, 2 are tensors. They are all supplied by whom? See, elevators, depressors and tensors. They are all supplied by whom? I mean they go and supply all these, right? Anterior division goes and supply. Posterior division, then it further gives 3 branches. One is auriculotemporal, I already told you, in middle meningeal artery, don't forget it. Then next is inferior alveolar और linguinal nerve. Linguinal nerve किधर से निकलता है, किधर से निकलता है linguinal nerve? You have to learn. Remember, in the mandible, if they ask you the bone of mandible in the viva, you will be asked about lingual nerve, and especially about the tongue. Anterior 2/3 it is going to go and supply general sensations, right? Then inferior alveolar nerve, it is responsible for what? Lower teeth pain. Lower teeth pain. Lower jaw. लोअर जॉ, ये तुम्हारी टंग है और ये लोअर जॉ, इधर के दांत. अपर जॉ बाय this, see, upper jaw is formed from what? Palatine bone and the maxillary bone. So maxillary artery, maxillary nerve takes care of this maxillary jaw, and mandibular jaw, this mandibular nerve is going to take care. Which branch? Inferior alveolar branch. And lingual nerve is seeing general sensation of the tongue. So it is as simple as this. Also, inferior alveolar is supplying two muscles, that is the myeloid muscle and the anterior belly of digastric, and these are nothing but what? These are the depressors. Depressor, we saw only one main important depressor is the lateral pterygoid, or ye, these are the accessory myeloid muscle, which is the oral diaphragm, and anterior belly of the digastric. I already showed you in the diagram. So these are supplied actually by the inferior alveolar branch, not from here. Just for remembrance of purpose, we are writing anterior division. Okay, understood? So I hope I am able to concise the big trigeminal nerve today. Good luck, and thank you. We will continue tomorrow with the facial nerve, and I think we just have 4 5 lectures. So thank you. In case of any doubts, you can always ask me.